Hi, I'm Dr. Joe, and welcome to this episode of the Dr. Joe Show. Today we're going to be talking about the second leading cause of blindness worldwide, glaucoma. Now, when we talk about glaucoma is more of just a generic umbrella term describing extensive retinal ganglion cell death in the back of the eye, which is also coupled with a distinctive cupping pattern on the optic nerve head. Now, glaucoma is a silent blinding eye disease, which means that you don't really have any indication of it developing or progressing when you have it. So this is why when you go to the doctor, they'll test you using the air puff or bringing a blue light close to your eye because they're testing for a significant risk factor for developing this condition. And that's called high intraocular pressure, also known as high IOPs. Other risk factors for developing this condition include being of African American or Hispanic ethnicity, having a family history of glaucoma, or having what we call a thin central corneal thickness. Now, while doctors can't really change your ethnicity or how you have a family history of glaucoma, we can change one of the risk factors, which is IOP. And we do that mainly through the medicinal use of certain eye drops, which include, if we want to, let's say, decrease the production of fluid inside your eye, thus lowering the pressure inside the eye, we'd use things such as timolol, Alphagan, or Trusop. Hello and welcome back to the second installment of the Dr. Joe Show. I'm your host, Dr. Joe. Today I'm going to talk about the leading cause of blindness, those 20 to 64 years of age in the United States, diabetic retinopathy. Nearly 1/4 of all diabetic patients will have diabetic retinopathy to some degree, and this is related to how out of control their blood sugar is and how long they also had diabetes for. So when I talk about diabetes, we're looking back here and we're talking about diabetic retinopathy. So this whole image is the retina here. This is your optic nerve, and these are the vessels that are coming out of your optic nerve. The dark ones are the veins, the lighter ones are the arteries. So in a normal retina, you won't have all these dark red spots here. So what that is just areas of hemorrhaging, which is common in those with diabetic retinopathy. You also see some of these lighter colored specks here. This is just some protein that's leaking through, and that's also common in those with diabetic retinopathy. Now, when this gets too out of control, this can affect your vision. If left untreated for a long period of time, this can cause permanent vision loss.